Hello, I'm Dr. Kondwani Kawaza. I'm in charge of looking after newborns at Chatinga Nursery here at Queen Elizabeth Central Hospital. In this session, you're going to learn about CPAP, which stands for Continuous Positive Airway Pressure. CPAP is standard treatment for helping newborn babies with difficulties breathing in the developed countries. And now we want to try to bring this therapy here in Malawi. CPAP is better than using only oxygen because it provides a little bit of pressure to make breathing easier. Often, very small or premature babies have stiff lungs and they need a bit of help to breathe. CPAP has not been available in Africa because the machines used in the developed world cost thousands of dollars. So we asked a group of medical engineers from Rice University in Texas to come up with a more affordable CPAP delivery system which could be used in Africa. We now have a low-cost and easy-to-use version of CPAP, which we call the Pumani CPAP.
This is the Pumani bubble CPAP device that we have developed at Rice University. It costs between $300 and $400 as compared to the $6,000 devices used in the developed world. And the reason that the CPAP is so low cost is that the airflow is provided by 2 aquarium pumps that are inside of this box. And these pumps are simple to use, simple to repair, and also very low cost. And the box is also made of sheet metal, which keeps the cost low and could be manufactured in places like Malawi. I will demonstrate how to assemble the bubble CPAP device before it's attached to the patient. So you should have the CPAP machine and 5 components: the bottle tubing, the patient tubing, the nasal prongs, and the power cord. Okay, and then I'll fill the bottle with water. Patients typically receive between 5 and 8 centimeters of water in the bottle. And you can use still water or tap water to fill the bottle. And place the lid on. And just check and make sure that it's at the level you want. And place the lid on the bottle. And then place the bottle in the bottle holder. And then you will attach the bottle tubing. It's impossible to get the bottle tubing and the patient tubing mixed up because it will only attach to one port. The patient tubing is attached here. And all the connections should snap into place. And at the other end of the tubing, the nasal prongs are attached. And this is placed on the patient's face, and the airflow flows through the nasal prongs and delivers pressurized air to the patient. And then finally, you will plug in the machine in the back. And then you'll turn on the machine and make sure that the red light is on that shows that the machine is on. If the patient needs additional oxygen, that can be attached at the oxygen port. And the oxygen flow is adjusted with this flow meter. And the total flow provided to the patient is adjusted with this meter. So a patient typically starts at 6 liters per minute of blended flow. And it's very simple to know that the patient is receiving air because when the prongs are blocked, the water bubbles.
Here at Queen Elizabeth Central Hospital in Blantyre, we've been using this CPAP machine for about 1 year with very, very positive results in our babies who are born with difficulties breathing. Our experience is that CPAP does make an important difference for small babies. This is funny. Most of our 3 weeks of life have been spent here at the hospital with a lung infection. She came here from a health center when only 7 days old, pale and struggling to breathe. She was one of the first babies here to go onto the CPAP. Initially she went on for 3 days, but the infection recurred, so she was put back onto the CPAP for a total of 11 days. Her mother was worried about using the machine at first, but saw the difference it made.
Mwana aisa mapuma bwino amathamanga kwambiri kupuma kwache. Koma ata mutamutenga kumwika pa CPAP pa mwana iyo akupuma bwino samayamwa koma panopo yamba kuyamwa ndipo ndikuona ngati panopo ayi chithandizo choyenerereka kwambiri. Chifukwa chokuti mwana amene ni mmene analili sindimaziwa kuti angakhale chonchi.
Now Fanny is really getting better and is feeding well. Her experience is typical of the babies we have treated here. We've not just been using CPAP. We've actually done a formal study to evaluate how well it works. And that's why we can be sure now that this is very helpful therapy that we need to bring out to the rest of Malawi.
It was important for us to see that CPAP was really going to work for our children. I think all of you are aware of how children, when they're either very small or they've got a severe infection, have huge difficulty in breathing. And we wanted to make sure that by helping them with this particular machine, we were going to save some lives. So in the neonatal unit in the Queen Elizabeth, we had 2 machines. That wasn't enough for all the children who needed it, but it meant that we could at least put 2 children at a time onto the machine. And there were other children who needed it but couldn't go on, and we asked those parents if we could follow them and see what happened. They were getting oxygen like most of us would give to any child who was having difficulty breathing. The results, when we analysed them, showed that those who had been on CPAP, 2 out of 3 survived. That's 67% it was. Whereas if we looked at the children who'd only received oxygen, only a quarter, that's 1 out of 4, it was actually 24% survived. So there was a clear improvement if we managed to put children onto CPAP. It was clear too that this helped particularly the very low birth weight babies, because those are the ones who have immature lungs and they're just frankly getting tired when they're trying to breathe. And a machine that just helps keep those lungs open for a little bit longer, because that's what CPAP does, it increases the pressure a little bit, stops the lungs from collapsing. It's those children who do particularly well. It is beneficial to those who have infections, and it is beneficial to older, heavier children, but less so, I think, less convincingly so than the ones in the low birth weight group.
As a doctor, I feel great satisfaction at seeing babies recover. We have also found that CPAP has not disrupted the normal routine of the ward.
It's easy to save babies in a short time with a CPAP machine. They get better. The respiration disease get quicker, clear, and the baby start breathing very well, and the mother are happy.
It's a good machine. I was afraid. I thought I couldn't manage to operate it. But after learning, it was easy.
The mother think the baby is going to die. But when we explain and put on the machine, there's a change in about 6 hours. They saw the progress of the machine. That is very useful and happy.
My grandson was sick. He showed signs of respiratory distress. I said, no, this one needs CPAP. And we went to maternity ward necessary, and she was put on CPAP by Dr. Hans. but my baby recovered in 18 hours. Then she was put off on CPAP.